And we are back on Gun Radio Utah, where there are no apologies. And continuing with the no apologies, as promised, we have some guests in the studio. So we have moved everybody else out of the way, and they are now sitting facing me at a distance where they cannot. Well, you can't touch me with your arms, so you're far enough away. You can't smack me upside the head or anything like that. But I'm very pleased to welcome back into the studio Kim Myers, Suicide Prevention Coordinator for the state of Utah. Thank you very much for being here, Kim.
Thank you. And we do have things we can throw at you in case we can't reach.
Okay.
Kim's a very good shot.
Right. Okay. All right. And we have Morissa Sobelson. And I'm saying that right?
That's right.
I've just called you Morissa all this time. Morissa, you come from the Boston area.
I do.
That's right. And as promised, you are...
Although a New Hampshireite by birth, so maybe I get some points on this show.
You know
for
what?
that.
You get a lot of points for that on Gun Radio Utah. You're the study coordinator, and you're a Doctor of Public Health student at the Harvard School of Public Health.
That's right.
Did I say that right?
Yes.
That's a lot of stuff.
You got it right. You don't need a Harvard degree, apparently.
Harvard? I think, aren't you supposed to pronounce it Harvard? Anyway, we are here. We're here for a very serious type of thing, though. 2 years ago, Representative Brian King worked with the Utah Shooting Sports Council, the National Rifle Association, and other interested groups in developing a bill called Suicide Firearm Data Study. It essentially gave the impetus to start a study on suicide firearm and the data around that. Kim, tell us what that bill did, what that started.
So the bill created sort of an outline of data elements that we could look at to better understand firearm suicides in Utah. We know that firearms account for over half of all suicide deaths in Utah, and that's pretty consistent, nationwide. And so it gave us some funding and some opportunity to study it better so that we can engage in better prevention efforts.
Okay, so there's another way to actually look at it too, in that firearms, account for over half of all suicides, right?
Right.
But of the firearm deaths, all the firearm deaths, isn't it around the high 80s or low 90s?
Yeah. So of all gun deaths in Utah, suicides account for about 86% of all gun deaths. So it really is, when we look at firearm safety and we look at how do we decrease deaths by firearms, we're really talking about suicide in Utah.
So, of the four ways people can die via a gun, there's accident, there's legal intervention, via self-defense or law enforcement, there is homicide, and there's suicide. And you're saying that of those four, 87% of all the gun deaths are suicide.
Yep.
All right. Now, tell us about this study. It was done over the last 2 years, I gather?
Yeah, it's been going on, to varying degrees over the last couple of years as we've gotten all of the sort of data sharing and contracting in place. And we're looking at a handful of factors. So what we want to look at is what are the circumstances that the person who died by suicide was experiencing in the sort of days, weeks, months leading up to their deaths. So we're looking at circumstantial data. We're looking at healthcare related data. What were their touch points in healthcare in the years before their death? So were they recently seen in an ER or at a primary care doctor's or otherwise? So we can sort of educate healthcare on how to engage in better prevention efforts. And then we're looking at sort of a history when it comes to did they legally own the gun? Interesting.
Morissa, what role did you play as a Doctor of Public Health student?
Yeah, well, Clark, my mentor in this project and the person who's really running the day-to-day of the study is Kathy Barber.
I know Kathy.
You know Kathy.
Tell Kathy hi for me.
She's a real friend of the Utah Shooting Sports Council and of other stakeholders here.
Does she say that? Does she say that?
She does. She does. She doesn't yet have a hat, but you could maybe work on that.
Really?
Yeah. But Kathy is an incredible researcher, not just because she understands the data and what's going on, but she has a real belief that in order to solve this issue of stopping people from dying by suicide, we have to work with gun owners. This can't be an oppositional us versus them relationship. It's just really counterproductive. So she's done incredible work here in Utah with you and Kim, which you guys can speak way better to, and also in New Hampshire in particular, where I'm from. And I think that's what's so powerful is it's about building trust, as you've helped me understand, and using that as the basis for making change, as opposed to it having to be about gun rights or gun control solely. So that's been what I've learned. And then when I came to Utah this summer, working with Intermountain Healthcare, you were so welcoming to me, Clark, in taking me shooting for the first time, and Kim really immersed me in the whole coalition of stakeholders here. So that's what I'm trying to do, is to help certainly with the data analysis, crunching all the numbers, but also to help build more connections within Utah, where I'll be moving in a couple months, to ensure that that data can help influence positive change. And again, with that sort of like collaborative attitude that this is really not about accusing or blaming or even necessarily like policy around taking away guns at all. This is about just safety and saving lives.
Yeah, we look at it with Utah Shooting Sports Council as educating. We're being educated, and I want to get back to what kind of data we found out or extrapolated from the survey. And education is always better than following around in ignorance. So what? And either one of you can answer this, Kim or Morissa. What types of things? What are some preliminary findings that we found out about this, about firearm deaths, suicide deaths, or with firearms in Utah?
Sure. So I think a few highlights that we've seen so far are around that suicide rates are highest in our rural counties, and that's driven by a really large amount of firearm suicides. So we have a lot of, like you say, education to sort of go out and help people understand that, firearms can be used in this way that we don't want in these rural counties, and to look at sort of safety issues there. We also reinforce that we know that the firearm that's being used in the suicide deaths either belongs to the decedent or the family, so it is coming often from within the home. And so we need to think about what that means in terms of safety inside of our homes.
And actually, on that point, Kim, this didn't come out of our study, but I think the stat is that of youth who die by firearm suicide, 85% sadly are getting that firearm from a parent. So I think that the opportunity for prevention here is huge. But again, that statistic comes from previous work.
Yeah, and I think that was found here as well.
How were the questions asked? Were they by mail, email, in person?
These questions are extrapolated from a database called the National Violent Death Reporting System. So it's questions that death investigators ask at the scene, and then are corroborated by the medical examiner who does the autopsy and finalizes the report and certifies the death of suicide. So this is from existing data elements.
All right. So I know that when we're developing the parameters for the study and everything about it as to what questions would be asked, because we wanted a lot of questions. Obviously, I know during the makeup of this bill, we also put out there the certain parameters as to who would be asking the questions, because we didn't want ideology creeping into it. And having worked with Kathy Barber at the Harvard School of Public Health, I was very happy to see this is somebody I actually trust. And I know you're thinking, oh, it's Harvard. Yeah. And hey, that is not lost on me either. So, but I was very happy to see that they were awarded that I don't know if it was the study or the option to do that. So excellent. Now, so what do we hope to do with this information, and how much longer until we can really start working with the information that we have?
Sure. So the study should conclude this summer, and so we'll have the final sort of data elements. We'll be able to report that back to the legislature, and they can sort of use it to guide policy level work. But for me, the important stuff coming out of it will be, how do we guide real prevention services? So, we're working now with our community prevention folks who have partnered in a lot of areas with firearm retailers, shooting ranges, their concealed carry instructors in their areas to help sort of spread the education on suicide prevention. And so hopefully this will help guide what information we should be including in that and what kind of resources people need. So hopefully it just helps increase our prevention efforts. I mean, Utah has really done a lot in terms of talking about this issue. So this will just help continue us down the right path and making sure that we're using limited resources in effective ways.
So, Morissa, how many other states have done something like this? Are there a lot, or are there?
That's such a good question. I don't think anyone has quite looked at the issue from this many angles in a single state or locality. You know, what I think is really special about the way that this is being set up and also really complicated is that data are coming in from a lot of sources. So the number of levels of kind of coordinators at different government agencies and these national databases, it's a bit of a knot that we're sort of untying to make sense of all these different pieces and do justice to them. But I think what's special about this is, you know, one thing I sense is that in order to drive change and build trust, just bringing in kind of national studies maybe doesn't really speak to people. Having that local sense, you know, we're talking county by county, understanding what's happening, what the trends are. I think my hope is that gives us that granular level of knowledge to get on the same page and to come up with some good solutions. So I think it's pretty unique in that respect. But it's a great question. We should find out what other states have been engaged at this level.
Well, you know, I mean, to the degree that we can find some commonalities, we can compare and contrast, you know, to the degree they're not common or different. I mean, Utahns, we like the fact that we're different, that we're somewhat, that we're unique. I was going to say, I'm trying to use the right word here. It's unique. And someone's calling. Why would someone be calling me? Stop calling me right now. I'm on the radio. Kim, what do you think? If you could, just with the data that we have, because you've been doing this for a long time, what could you tell folks out there right now? What could you tell that might be experiencing some, maybe it's depression, maybe it's something like that, or maybe they see something like that in another person?
So one thing I would say is to make sure in your home that you know nobody is immune to this. So don't assume that this could never happen to you or somebody that you love. So take precautions beforehand. And if you're struggling, please reach out. This is not, you know, a weakness of character. We all experience depression. Depression is the norm in people's lifetime rather than the exception. So it's okay. Reach out. You don't need to suffer needlessly. Let us help connect you to resources, and let's make sure that people who are struggling don't have access to firearms during that temporary period of time.
Excellent advice. Morissa, I can give you like 15 seconds.
Yeah, I mean, I think just one thing that strikes me from the data is that one of the things we know is that gun owners are not more likely to be suicidal. It's just that they have access to this really lethal means. And
okay,
so
thank you for saying that.
That can be irreversible. So
excellent. Excellent. Kim Myers, Morissa Sobelson, thank you very much for being here, and we hope to hear back from you, from both of you, more on this.
Thank you so much.
And we will be right back on Gun Radio Utah. Stay tuned, but listen to these important announcements.